Welcome to VU Academy. Today we will learn about the asthma. The asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to difficulty in breathing. It can affect the people in all ages and it varies according to its severity. So, according to this picture, you all can see that the asthma is causes due to the chronic airway inflammation. The endothelial cells, which are lining the vessels, become dysfunction, leading to increase their vascular permeability and make them swelling. This contributes to plasma leakage and making the airways to more swollen and sensitive. In our next slide, let's learn about what are the causes and triggers of the asthma. The asthma is often triggered by environmental and genetic, including the allergens, irritants, respiratory infections, exercises, as well as weather changes, stress and emotion, and the certain medication. First of all, let's pay towards the allergen. Most of the allergens like dust, mites, pollen, pet dander, molds are causing the trigger of this asthma. And the irritants like smoke, strong odors, and the pollution may increase the asthma condition. And also the cold, flu-like respiratory infections also increase this condition. Further, the exercises and weather changes like cold air and the humidified air will trigger this condition. And also the emotional conditions as well as the stresses will trigger the asthma. And aspirin, beta blockers like certain medication also increase this asthma condition. Here you all can see that there's a picture depicting out the causes and triggering factors related to the asthma. Next, we will move on to our next slide relating to the symptoms of asthma. So these asthma symptoms can range from the mild to the severe, and those include shortness of the breathing, wheezing, coughing, chest tightness or pain, and the difficulty in sleeping due to the breathing issues. So the wheezing is the whistling sound which we hear during the breathing, and coughing is especially occurring at the night or early in the morning. The other one is the chest tightness or the pain. In this picture, you all can see the symptoms related to the asthma very clearly. In our next slide, we will move on to the asthma attack. So what do you mean by asthma attack? So asthma attack is a sudden worsening of the asthma symptoms, mostly due to the inflammation and the bronchospasm and due to the excessive mucus production. So this may lead to severe breathing difficulties, which can become life-threatening even if we don't treat it at the correct time. So let's see what are the warning signs and the symptoms related to the asthma. The signs are a headache, stuffy or runny nose, a sore throat, coughing or wheezing after exercise, difficulty in sleeping, feeling moody or irritable, tiredness or weakness during the physical activity. The symptoms are the chest tightness, coughing especially at night or when laughing, difficulty in breathing, shortness of the breathing, and sleep problems resulting from breathing issues, and a wheezing or whistling sound in the chest when exhaling. Now, let's see about what are the types of the asthma. The first one is the extrinsic asthma or the allergic asthma. So, this kind of asthma is triggered by the allergens like pollen, dust, or pet dander. The second one is the intrinsic asthma or the non-allergic asthma. So it's triggered by the factors like infections, stress, or exercise. The third one is the exercise-induced asthma. So it occurs during or after doing the physical exercise or activities. And the fourth one is occupational asthma. As we all know, some are working in the workplaces like more chemicals and fumes are present. So those will trigger this asthma condition. And some other asthmas are worsening at the night. So they are known as the nocturnal asthma. Now let's move on to the other slide. So let's see how to diagnose the asthma. The asthma can be diagnosed by the medical history and evaluating the symptoms of the patient, and also by doing the physical examination of asthma patient. So under this physical examination, we are mainly focusing towards the uh, respiratory function, how they are working. It means by detecting of the signs of airway obstructions and by ruling out the other conditions. So it includes mainly the inspection, palpation, percussion, and the auscultation of the lung. Under the inspection, we see normally the asthma patients have the struggling of the breathing. They are taking rapid breaths and use sometimes accessory muscles like neck, chest, and the abdominal muscles for the breathing purpose. And also, these patients are having bluish color lips and the fingernails. So this condition is called as the cyanosis. In cyanosis, what happens? It causes the deprivation of the oxygen. And also, the some patients are doing the breathing by leaning the forward. So it makes them for the easy breathing. And the other one is the palpation. The palpation means the touching the patient chest. So uh, in the palpation, we examine about the chest expansion. So in the both side. So during the asthma attack, what happens? This chest expansion may reduce. And also the other thing is the tachycardia. In the stress and hypoxia conditions, our heart rate will be increased in this asthma patient. So that condition is called as the tachycardia. The other thing is the pulse paradoxus. The pulse paradoxus is seen in the severe asthma attacks. In that case, there is a drop of the blood pressure occurring during the inhalation. The third step is the percussion. The percussion means the tapping the chest of the asthma patient. Normally, in the mild cases, this is normal. But in the severe cases, we can hear the hyperresonance during the tapping. The fourth one is the auscultation. So, auscultation means listening to the lung sound with the stethoscope. So, by listening, we can hear the wheezing sound of the asthma patient. It means a high-pitched whistling sound especially occur during the expiration, and they have a prolonged expiratory phase due to the narrowing of the airways, and also they can